Good afternoon, everyone. Welcome. We're so happy to have you here joining us on your lunch hour for this webinar, which is brought to you by the Minnesota Water Research Fund. My name is Shannon Walkerstorfer, and I work in the College of Science and Engineering Advancement team, where part of my role is working with the Advisory Committee of the Water Research Fund. And before we get started on today's presentation, we're going to move to the next slide and just talk about a few housekeeping items. If you'd like to listen to this webinar by phone, you can see the dial-in instructions on your screen, and they were also in the email confirmation you received. We, of course, welcome your questions for our expert panelists today, and we'd like you to submit them anytime during the presentation using the Q&A feature found at the bottom of your screen. We want to remind you that this event is being recorded, and we'll be sharing the video recording with all registrants in the next couple of weeks. It'll also be posted on our website. Finally, if you run into any technical difficulties, go ahead and use the chat feature. My wonderful colleague Katie is behind the scenes and she can help you do some troubleshooting. Okay, well, without further ado, it is my great pleasure to introduce you all to the chair and founder of the Minnesota Water Research Fund, Bernie Bullard. Bernie is a visionary philanthropist and a University of Minnesota alumnus who created the fund in 2015. He is a well-known leader in the water and wastewater engineering field and led the city of Minneapolis Water Services and Water Treatment in his career, as well as being the leader of St. Paul Regional Water Services. Bernie has devoted more than 50 years of his life to making sure that our water is safe, and he's really passionate about finding research-based solutions to our most pressing water issues. So I'd like to turn it over to Bernie. Take it away.
There we go. I think I'm on. Thank you, Shannon. Welcome to our 7th research webinar. So glad so many of you could join us today. Special thank you to the Minnesota Department of Health who helped plan and create today's panel discussion. MDH is also a gold partner for our Water Research Fund. As Shannon said, I've spent my life and career as an engineer focused on water. And that's why I created the Minnesota Water Research Fund. I see this as a legacy for me. Research is essential to ensure that we have access to clean water for the 21st century. Our Minnesota Water Research Fund short-term goal is to annually fund top quality water research by the University of Minnesota faculty and students. We invest in excellent research and in the future talent pipeline by educating our future water industry leaders. We are making an impact. MWRF has already funded 13 faculty and student projects. This year, we funded 3 projects at $7,500 each to support graduate students. Our long-term goal is to raise $2 million to create an endowed chair. This will support a faculty member who is an international leader in this field. We also regularly host these webinars like the one you're listening to today and watching. We're hosting it through a broader audience, alumni, water industry leaders, and external stakeholders. For more information on the Water Research Fund, please visit our website. Fundraising and bringing new partners to our work helps drive our success. I'd like to thank our 2024 partners who have stepped forward, joining us to make our dream of long-term ongoing water research a reality for Minnesota. We have 28 generous organizations and individuals that were sponsors this year and help us make great strides at the Water Research Fund. And I want to give a special thank you to our gold level partners, Hawkins Chemical, Minnesota Department of Health, Minnesota Pollution Control Agency, and SL Circle. If you or your organization would like to become a 2025 partner, we'll provide more information on this toward the end of the webinar. With that, I'd like to turn it back over to Shannon so we can get us started with our panelists.
Thanks so much, Bernie. We are so delighted to hit the main event, and we've got 4 fantastic water experts with us today. And I have the pleasure of introducing our moderator for today's discussion, Carla Peterson. Carla is the Drinking Water Protection Chief Engineer and Technical Advisor at the Minnesota Department of Health. A registered professional engineer, Carla has a bachelor's in civil engineering from the University of Minnesota, and she also has her master's in public administration from Hamline University. Carla has more than 30 years of experience in the state's drinking water program, and she's a member of several organizations, including the American Water Works Association, where she served in a variety of roles, including as a past chair for the Minnesota section. Carla, thanks so much for serving as today's moderator, and I'll let you take things away.
Thank you. So I'm very excited to be here and just want to say what a pleasure it is for us at the Minnesota Department of Health to be joining the Minnesota Water Research Fund for this webinar. MDH is very proud to be a gold level partner supporting excellent water research and students who may follow in our footsteps in the water industry. And personally, I'll say someday I would like to be one of the gold members as well. So that's something that I would like to leave as a legacy myself. So I encourage others to do the same. So cases of Legionella. These cases have increased here in the United States and internationally for the past 10 to 20 years. As many of you are aware, Legionnaires is a deadly form of pneumonia caused by Legionella pneumophila. With the help of our expert panel today, we're going to dig into recent research into Legionella pneumophila and discuss approaches to managing public water systems to prevent the onset of Legionnaires disease. So we will start with my fellow panelists. We're joined by two University of Minnesota faculty from the Department of Civil, Environmental, and Geoengineering. The James L. Record Professor Raymond Hozalski received a bachelor's degree in chemical engineering from Villanova University and master's and PhD degrees in environmental engineering from the Johns Hopkins University. Professor Hozalski's research areas include drinking water treatment and the chemistry and biology of water distribution systems, including the occurrence and control of opportunistic pathogens. Professor Timothy Lapara earned a bachelor's degree in civil engineering from Notre Dame and a PhD in environmental engineering from Purdue University. His research interests include biological wastewater treatment, drinking water microbiology, microbial ecology, and antibiotic resistance. And last but most definitely not least, we've got Indra Kamalanathan. He's a Minnesota Department of Health compliance engineer with a focus on disinfection in drinking water, including bacteriological testing, disinfection byproducts, and surface water treatment. Thank you to all of you for being here today. I'll just also add that Indra received his bachelor's degree in chemical engineering from the University of Arkansas and a master's in environmental engineering from the University of Illinois at Urbana-Champaign. He worked as a consultant in wastewater engineering prior to joining the Minnesota Department of Health in 2021. Ray, Tim, and Indra, we're excited to have you to share your expertise with all of us on this important issue. We'll start by having Ray and Tim provide a brief overview of the research. Following that, Indra will offer the MDH perspective of how research helps inform approaches to managing public water systems to reduce the incidence of Legionnaires' disease. And then our panel discussion will wrap up with questions and answers. So please think ahead as to what questions you'd like to ask them. And you can just submit them in the chat as we go along. So Ray and Tim, I will hand it off to you. Thank you.
Thanks, Carla. Okay, so I'm sharing my screen. Hopefully everyone can see it okay. So I appreciate everybody joining us today, and I'll try to move through things quickly because we want to save plenty of time for some Q&A. So in terms of acknowledgements, I just want to start off by thanking the Minnesota Department of Health, who funded a lot of the work that we'll be seeing today, especially give a shout out to Sandeep Berman at Minnesota Department of Health. I'd also like to acknowledge US EPA for funding some ongoing work that we will share a little bit of. And then the Minnesota Water Research Fund is also funding some of our work in this area, although we don't have the data yet to share on that project. I'd also like to acknowledge U of M Facilities Management for helping us with our sampling activities, and then a whole host of graduate students and postdocs who are involved in this work. So first, a little bit of background. We're going to be talking today about opportunistic pathogens. An opportunistic pathogen is a microorganism that normally does not harm its host, but can cause disease, especially when the host's resistance is low. So you're talking about folks that are elderly or undergoing chemotherapy or have some other ailments. And so some examples of bacterial opportunistic pathogens, or OPs, include Legionella pneumophila, which you'll be hearing a lot about today, as well as Mycobacterium avium and Pseudomonas aeruginosa. Again, we're going to be focusing on Legionella, in particular Legionella pneumophila, in this talk. And so these organisms, in particular these OPs, normally the route of exposure is through inhalation of aerosols or tiny water droplets that are contaminated with these organisms. And that can happen in a shower, it can happen in a hot tub, or through HVAC systems like cooling towers that are contaminated. And so one thing that we've been noticing about Legionella, as Carla alluded to in her introduction, is that incidents of Legionnaire's disease are increasing in many developed countries around the world, including the United States, Japan, and Switzerland, as shown in these data that were compiled by Frederick Hammes in Switzerland. There are over 50 species in the genus Legionella, and approximately 20 are believed to be pathogenic. And by pathogenic, we mean they've been associated with disease in humans. Legionellosis refers to any illness or disease caused by bacteria of the genus Legionella. In particular, we're going to be talking about incidence of Legionnaire's disease, as shown in that graph on the right. That's a potentially fatal, very serious pneumonia disease. Normally, a person who contracts Legionnaire's disease will seek medical attention. The death rate is potentially 5 to as much as 30% for hospital-acquired Legionnaire's disease infections. Pontiac fever is a flu-like illness which typically resolves on its own in a few days, and most people that get Pontiac fever would not seek medical attention. Legionella pneumophila. So Legionella pneumophila is the species that's responsible for approximately 90% of reported Legionnaire's disease cases. So we're going to especially be focusing on Legionella pneumophila today. Many of you have heard, and so one question you may ask, especially if you're a Minnesota resident, is Legionnaire's disease a problem in our state? And I wouldn't say it's a widespread or chronic issue everywhere, but there have been incidences of Legionnaire's disease and outbreaks in Minnesota, including a very recent outbreak in the city of Grand Rapids in northern Minnesota. I think the total number of cases was on the order of 23. Although fortunately, there were no fatalities that I'm aware of. That city has developed or started chlorinating the water. They did not chlorinate during the outbreak, but as of June of this year, they started chlorinating. And we will talk about later on some data before and after the addition of chlorine and show you the benefits of chlorination. So just some back of the envelope calculations, like how many Legionella or what concentration of Legionella in our water is needed to make us sick, or what threshold should be of concern, I should say. So some data suggests that we inhale on the order of 11 to 14 milligrams of water, or about 0.011 to 0.014 milliliters of water during a 10-minute hot shower. So if those numbers are assumed, then to become sick, there's some other data suggesting that we need to inhale at least 5 Legionella pneumophila bacteria. And so if you just do some simple math, you can calculate a concentration on the order of several 100,000 bacteria per liter. So these are very high concentrations of Legionella pneumophila, and it's rare, but it does happen. And so again, these are concentrations that we need to be thinking about and making sure that we maintain our water quality so that we never achieve levels as high as several 100,000 per liter. So when I think about Legionella and Legionnaire's disease, we need these high concentrations. So that's kind of like, a massive bloom of these organisms. And I make the analogy to a fire. And so the opportunistic pathogens are basically omnipresent in surface waters and water supplies, including groundwaters. These organisms are just naturally occurring in soil and water. They're not associated with fecal contamination, unlike conventional coliforms that we use as indicator organisms. So coliform test is not a good indicator of the presence of these bacteria in our water supplies. So I would assume that we've got them in our water supplies almost everywhere. And so that's the match, the match that can start the fire. In order to keep the fire going, we need oxygen, and normally there's plenty of dissolved oxygen in our water supplies. And so then we also need fuel, and that fuel we can refer to as assimilable organic carbon or biodegradable dissolved organic carbon. And so if we have fuel and we have oxygen, then we can potentially have a bloom with these organisms, but we can also have a fire extinguisher, in this case, chlorine. So if we can use chlorine or chloramine, free chlorine or chloramines, we can normally keep these organisms under control. So that's our kind of our fire extinguisher. There also are some building relevant issues that may exacerbate problems associated with opportunistic pathogens, including the hot water temperature, which Tim will talk more about later. The water age are there stagnant areas of buildings where the water age is increasing and potentially causing problems with respect to low chlorine levels? If we have elevated water ages, are we flushing those outlets to make sure that we can try to move the water through the system and keep it fresh? And then if you practice on-site disinfection, that also might help control these organisms. Okay, so there's plenty of work historically that's been done about Legionella in buildings. I'll just have time to cite a few papers or a little bit of work by, for example, Marc Le Chevalier, well known in this area, and then another paper by Flannery et al. So if you look at some of the work that Marc has published, and it's not surprising that this top graph shows the occurrence of Legionella as a function of free chlorine concentration. And basically what Marc is showing in this plot is that once we got detectable levels of chlorine above 0.1, 0.2 milligrams per liter, basically the Legionella and Pneumophila were controlled and were non-detect to extremely low levels. So by the same token, increasing temperatures, so when we get temperatures approaching 20 degrees Celsius or 68 Fahrenheit and above, we tend to see a higher incidence rate of Legionella and Pneumophila in our water supplies. Also, there's a question about, is free chlorine better than chloramine or vice versa? There was a study published from a full-scale changeover in San Francisco from free chlorine to chloramines. And so the data for free chlorine system are shown on the left 3 panels, and you can see lots of red and colored filled blocks. And so that indicates detections of these Legionella species. And then when they switched over to chloramine, you see the 3 panels on the right, and that's showing very low incidence rates of detection of these Legionella organisms. And so I'm not saying that chloramine is the only answer. The issue was that free chlorine is very reactive, and they were having a hard time maintaining free chlorine through the distribution system, through the hot water heaters, and out to the taps. However, chloramine tends to be more stable, and so that was able to survive the water heaters and make it all the way to the taps. So just having some chlorine in the water enabled the system to really reduce the occurrence of these organisms, and chloramine was the answer in this case for San Francisco. And we've also done some work where we showed that Legionella is much more prevalent in the biofilms when we did not have residual disinfectant than when we did have residual disinfectant in the form of chloramines. So what are the research questions that we're going to be discussing today? First one is, do opportunistic pathogens accumulate in stagnant water in inactive buildings? And for this work, we took advantage of, if you will, the pandemic that happened in the spring of 2020, when many university buildings were closing and students were basically told to leave campus. And so then we took advantage of that opportunity to go into these inactive buildings and do some sampling. And then the second question is, does flushing improve water quality? If it does, how long does the improved water quality last? And then finally, is chlorine needed to control Legionella? If we just flush with any water, chlorine or not, does that help control Legionella? Or do we really need chlorine around to protect our water supplies from opportunistic pathogens? So our study sites were 5 University of Minnesota buildings, 4 on the Minneapolis campus supplied by Minneapolis Water Treatment and Distribution Services. They get their water from the Mississippi River, treat it with lime softening, filtration, through disinfection, and they supply the water with chloramines, normally in excess of 3 milligrams per liter as Cl2. We also sampled 1 building on the St. Paul campus that is also supplied by the Mississippi River, ultimately through a chain of lakes, treated very similarly and also supplied with chloramines. And then we also sampled a suburban high school, which is supplied by a deep groundwater with low levels of free chlorine, usually below 1 milligram per liter. And then we also sampled a youth camp about 45 minutes or an hour from the metro Twin Cities. And there we sampled 3 different buildings supplied by 3 different groundwater wells with no chlorine or essentially no treatment of that water. What we did in the field, we would go to the inlet of the building, we would flush the building inlet to make sure we're getting fresh water from the building or from the mains supplying that building. We would also record the water meter value so that we could ensure that these these buildings were in fact largely unoccupied. Then we would remove the shower head with a wrench. We would flame the shower head to ensure that we didn't have surface contamination of those taps. Then we would turn the water on and immediately collect that first draw sample representing the old water that had been sitting in the pipes. And then we just let the water run for up to an hour or more, and we would periodically collect more water samples. We would bring those samples back for testing, and Tim will get into that in more detail later. We also on-site measured free chlorine and chloramine or total chlorine concentrations. We also measured pH and water temperature. When we were done for the day flushing, we would turn off the water supply. Again, it was either full hot or fully cold. Then we would cap the supply, and then we would come back a few days later and sample that first draw again, not flush, just collect the first few hundred milliliters, turn it off, cap it, and then we would come back up to 5 days to a week later and then sample again. So we're looking at the effects of flushing on water quality long-term, so days after the flushing event. So with that, I will turn it over to my colleague, Tim Lepar.
Thank you, Ray. Hang on just a moment. Okay, so once we've collected the samples as Ray has described, basically, so that's sort of the faucet shown here. We would then, we'd collect about 1 liter at a time. We would then concentrate the cells by conventional vacuum filtration. And then we would extract and purify the DNA. And then we would then use a PCR technique. So if you've ever had a COVID test, there's sort of 2 types. There's the at-home antigen test, and then there's the PCR test. So we're basically doing the same thing with PCR, but we're looking for bacteria in the water rather than COVID in your nasal passages. So that's what we're showing here on the right, are sort of the machines that we use to quantify the quantities of those genes in our samples. And then the other thing we did is we did a culture-based assay, it's commercially available from IDEX. And this is intended to grow Legionella and quantify it similar to like an E. coli or coliform test. And so what you see on the left is a sample that was negative for Legionella, and what you see on the right is a sample, this is probably a positive control, where we saw very low levels of Legionella pneumophila. Actually, to be specific, this culture's Legionella pneumophila. Okay, so as far as the PCRs, the data we're going to show today, we look at total bacteria. We're going to look at all Legionella of all organisms of the genus Legionella, and that's the SSRA gene. And then we can also look specifically for Legionella pneumophila, which is the MIP gene. So that's one of the nice things about these genetic techniques. Once you get the DNA out of the sample, you can keep querying the sample over and over again for whatever organism or gene that you are interested in finding. So sort of moving along with the data, and this is very important information. So this is a description of water temperature when we were doing these flushing experiments. So if you look over panel B at the beginning of that sort of first flush, we had relatively high initial temperatures for that first sample, okay? And then obviously as we start bringing in fresh water straight from the mains, the water temperature goes down. Essentially what's happened here is these buildings aren't in use, and the buildings that we used primarily were very large university buildings with lots of premise plumbing. And so it would take some time, but you can see fairly quickly the water temperature decreased to some sort of asymptote, which is probably the temperature of the water in the water mains. The hot water systems were similar. You can see initially in this case, they're colder than what you would expect. And then as we turn on the water, bringing in hot water, temperatures would increase. Admittedly, and again, as Ray had said, this was during the COVID pandemic, and a couple of occasions, the water heater system was not functioning correctly. And so some of these actually, one of them got colder, the other one remained sort of stagnant at approximately ambient temperature. Sort of similar type data, but this time we're looking at the combined and or free chlorine level. So this is total chlorine. And what you would see is initially in most of our samples, there was no chlorine in that water that had been sitting there stagnant for several weeks at a time, similar with the hot water. In general, what you see is that, and this is both Minneapolis and St. Paul, so this is chloramines. We would actually see chloramine levels at approximately 3 milligrams per liter, which is what Ray had previously said is sort of the set point or the targeted points for Minneapolis and St. Paul water. The hot water heater system is a little bit different. All systems showed that chloramine got through the water heater to a certain degree, but obviously there is some decay through the water heater, but chloramine did make it through. Okay, so we see increases in chlorine levels as we bring in the fresh water from the water mains. So this is the data from the flushing studies that we did targeting all Legionella, and this is kind of a busy figure. I'll just walk you through it a little bit. This first sort of column is the inlet, what things looked like when we began. The middle column, the middle wide column is starting with that first draw through up to 45 minutes of flushing. And then Ray talked about capping that water and then coming back a couple days later to remeasure to see if there's regrowth. Okay, so this is busy, so I'm gonna get rid of some of that data and let's just look at the inlet water. And so what we see, the fresh water from the water mains on these top figures, essentially were non-detect for Legionella. And this is the SSRA gene. So all Legionella, they were non-detect. And so that's what less, and the number here shows the log 10 of the copies, and that's sort of shown for statistical reasons, but our detection limit is shown here. In St. Paul, we actually did detect some Legionella, and I will talk about, we have an idea of why that happened there. Okay, so then we do these flushing experiments, and what you can see, even though in the 4 Minneapolis samples, even though most of those samples, most of the water main sample was negative for Legionella, all of the water that had been sitting there stagnant in the premise plumbing had quantifiable and sometimes maybe 2 orders of magnitude higher concentration of Legionella. Once we started flushing the data or the water, very quickly, within 6 minutes, 100% of our samples from Minneapolis were then very much similar to the inlet water, which was non-detect for SSRA or any species of Legionella. The data was a little bit different in St. Paul. Again, the inlet water had some concentration of Legionella in it. Our initial first draw in all 4 cases had relatively high, in fact, some of the highest levels of Legionella or SSRA that we found. We did see a reduction with SSRA over time. Okay, so all of this is consistent with flushing helping even in the St. Paul, although I'll explain a little bit more in just a moment. And then there's sort of that follow-up where, again, once we left the gymnasium or building or whatever, there was no detectable Legionella in the water. When we come back in 2 to 4 days, you start to see some detections. And then after 6 or 7 days, we definitely see hits in which we were able to detect Legionella again. So we see some regrowth over time, suggesting that flushing is, the benefits of flushing is temporary. St. Paul, the situation was quite a bit worse. All of those samples tested positive. So you might ask, what's different between St. Paul and Minneapolis? Sort of our hypothesis or interpretation of this data is this was during the COVID pandemic, and the St. Paul campus is served by a single water tower, and that's what's shown here. And essentially, campus was shut down completely. So this was not necessarily, so even the water mains themselves probably had some stagnant water because water use was severely depleted for the entire campus during the pandemic. So we think that's what's happening there. But but the Minneapolis data shows really wonderful benefits, albeit short term, of the flushing. And then as Ray had talked about, we went to a high school in a nearby suburb where groundwater is the source, unlike Minneapolis and St. Paul, where the Mississippi River is the source of water. And what you can see in that groundwater is, again, the inlet water is essentially non-detect for Legionella. And then even that first flush data or samples, those were also non-detect for Legionella. So essentially, in this city, even though the building had been sitting there stagnant, there was still non-detectable levels of Legionella. We also went to the youth camp, and we studied 3 different buildings at that youth camp, each of which is served by a unique well. So these are replicate systems. They're all nearby each other, but they're totally separate and distinct. In one of the 3 buildings, we did initially see slightly higher levels of Legionella, but then with flushing within 30 minutes, they were all gone, either near detection limit or completely non-detect. And then in the other buildings, essentially, we saw no Legionella in any of the samples at any time. When we did the follow-up, we saw similar results, obviously, or to what we saw before, but in this case, we're seeing no evidence of any regrowth with the potential of 1 sample where it was very nearly the detection limit for the assay. Okay, and then in all of these samples, when we did the Legionella assay, they were all negative for Legionella pneumophila at all times. So that was good and encouraging. Okay, so what sort of happens during stagnation and flushing? In the stagnation period, we basically see that the residual disinfectant, if it's used, decays, and that's just a time factor. Okay, so in addition, the water temperature moderates. So if the hot water, if you're looking at your hot water lines, it gets cooler because we're not replenishing with water from the water heater. If you're talking about the cold water, it gets warmer because it's not bringing in fresh water from the distribution system. And once water temperature moderates and the disinfectant, which Ray very eloquently showed you as a fire extinguisher previously, once the fire extinguisher is gone and the temperature moderates, Legionella and other opportunistic pathogens can grow on assimilable organic carbon, assuming it's there. Our sort of general interpretation is with the groundwater systems that we showed, there is minimal assimilable organic carbon in that groundwater, and that's why we didn't see regrowth. Unfortunately, in that study, we didn't anticipate that result, and so we didn't actually make any attempt to measure the assimilable organic carbon. Anyway, so then assuming there's a period of extended stagnation, what does flushing do? Flushing can do a number of things. If it brings in fresh water from a distribution system, and that distribution system has residual disinfectant, it's going to bring in that residual disinfectant. It's going to bring in that fire extinguisher. In addition to fresh water, and this is a very Minnesota specific answer, it's likely going to be colder, okay? All is not perfect though. That fresh water also probably has more AOC in it. So as the organisms are growing, sitting there in stagnant water without a residual disinfectant, they will deplete the AOC. As we bring in fresh water, we will bring in more, okay? But the good news is, as long as that residual disinfectant is there, Legionella growth may be, or the quantity of Legionella may be actively reduced by the disinfectant, but as a minimum, it'll prevent growth of more Legionella cells. Okay. Okay. So, and then this is data that's very recent. The previous data has actually been published in the literature. This is data from Grand Rapids. Ray and I and our wonderful graduate students, many of whom are listening right now, have been doing some work there. This is all Legionella data. And we collected a handful of samples. We started with the finished water, 6 different locations within the distribution system. That's the DWDS 1 through 6. And then we looked at 3 different premise plumbing systems. And this is at the tap. So, and again, to be clear, this is during an active outbreak. And in winter and spring, so this would have been late February and May, we detected virtually no Legionella pneumophila in our distribution system sample. So this would be, again, that cold water. But in the premise plumbing, where water is warmer, even the cold water and definitely the hot water, we actually had several positive detections. And so this is most probable number per 100 milliliters. And you can see, for example, in this premise plumbing number 3, we had water detections or a quantification of culturable Legionella pneumophila of about 1,100 cells per 100 milliliters, or about 10,000 cells per milliliter. Now, luckily, this wasn't a rip-roaring outbreak of Legionnaire's disease in Grand Rapids, you can see these numbers are lower than what Ray said is needed to actually make somebody sick. But do realize these are snapshots, and we're probably not getting the maximum value that would ever happen. So this is consistent. The good news is that once it was recognized that there was a Legionnaire's disease outbreak, the city, the Department of Health stepped in, and prior to this, Grand Rapids did not disinfect their water, either at the source, and they did not maintain a residual disinfectant. Starting late June, early July, they then started disinfecting, and they very meticulously made sure that they had a residual disinfectant of at least 2 milligrams per liter of chloramine throughout their entire distribution system. And so that's what you see here. Again, all of the distribution samples had no Legionella. We go back to those same systems where there were problems before, and we see only one single positive detection for Legionella pneumophila, and it was much lower than any of the other samples that we had, all the positive detections that we had there. So sort of consistent with that model, that conceptual model that Ray had, once we put in the residual, once Grand Rapids put in the residual disinfectant, we put in that fire extinguisher, and levels of Legionella pneumophila were suppressed. So to sort of highlight the key points, what are the factors that allow Legionella to grow? It's going to be dissolved oxygen, and it's going to be warm to hot temperatures, and it's going to be assimilable organic carbon. Those are the basic fundamental mechanisms that allow Legionella to grow. The work that Ray and I have done, and this entire workshop, is largely based on drinking water distribution systems and sort of things that an environmental engineer would design, control, and maintain. Do realize that there are other opportunities for Legionella to grow. These basic factors still apply, but again, most of this is focused on public water systems. So in addition, and this is the other main key point, is that residual disinfectant limits Legionella growth, okay? And this sort of leads to what I like to call as the disinfection paradox. Free chlorine is a better disinfectant. It's more important, it's stronger, it's more potent. It'll kill things faster and better. But because it's a better disinfectant, it's probably less effective as a residual disinfectant because it's so reactive that it's less likely to pass through water heaters. It's more likely to decay in periods of stagnation. In contrast, chloramine is less reactive. It's not as potent of a disinfectant, and it's connected to, that means it decays slower. So it's more likely to survive a longer period of stagnation, and it's more likely to survive through water heaters, as the data that Ray showed earlier from San Francisco. Okay, so Ray and I are researchers, so kind of what are the next steps? We've talked a good deal about assimilable organic carbon. When we showed the groundwater systems, we assumed that was due to a lack of assimilable organic carbon. We don't have a lot of measurements, and we're starting to work on this now, but so that leads to some obvious questions. What are the levels of assimilable organic carbon that are needed to grow Legionella? There are ways to measure assimilable organic carbon. We can obtain that data and kind of have a better understanding of the potential for various public water systems to grow Legionella. This is really important for groundwater systems where some seem to not grow Legionella, like what we showed from the youth camp and from the suburban high school. But then there are other cases of Legionella where groundwater is the source, such as in Grand Rapids, Minnesota. The next question is temperature. We kind of give you this range where Legionella can grow, but those are probably almost entirely based on sort of pure culture studies, the temperature range of Legionella pneumophila and where it can grow. So but the real world is competitive, and there are other organisms that are there. So for example, I can play basketball, and I can score, I can, take a 15-foot jump shot and make it. But hey, you put Michael Jordan on me, I'm never going to score a point. Okay, so competition matters in the world of microbial ecology and in drinking water distribution systems. And then finally, this residual disinfectant. Public water systems and public water supplies try to sustain a residual disinfectant throughout their distribution system. That's really hard to do. And so the question is, how effective are they at doing that? So finally, some take-home messages. I think Ray and I are both very big fans of using chloramines as a secondary or residual disinfectant to limit colonization of Legionella pneumophila in premise plumbing and other systems. We did have some data that we didn't show you where we did find some other opportunistic pathogens, specifically Mycobacterium avium complex. All of the data I will tell you that we had suggest a low or insignificant risk of illness. The highest data that I showed you in this talk was still probably at least an order of magnitude below the level that Ray suggested could actually make somebody sick. This is actually really important for our research because our ability to detect Legionella in a water sample is far better than it needs. We're several orders. Our ability to detect it is much better than the level that would need to actually make it sick. We generally think that groundwater systems are less likely to have a potential for opportunistic pathogens, but as the Grand Rapids system shows us, that's not universal, and so that's probably poorly understood. Flushing your system really helps, particularly if you have residual disinfectant, but the results are fairly short-lived. So, don't think that one simple flushing will solve the problem for a month if things go stagnant again. So just sort of, and then finally, the solution to Legionella pneumophila and Legionnaires disease is a multiple barrier solution. We want various, we want to make sure that we do several things that protect us so that nobody gets sick with this disease. So one example is if you go on vacation for a week or more at your home, you could consider, or your building is inactive for, say, the summer if you're a school, you could flush out your system real quick before it becomes occupied again. Just turn on the shower, turn on your exhaust fan, let it flow out, and then bring in that fresh disinfected water. So with that, I think, yes, I will pass it off to Indran. So thank you very much.
Thank you very much for that from Ray and Tim. I should be sharing my screen now at this point. All right, so thank you again for this opportunity to talk, share a bit about how that research directly impacts what we do at the Minnesota Department of Health and how we look at Legionella. And I'll try to keep it fast. We can get to some of these questions as well. Thank you for posting those. So current guidance, we currently do not have a direct monitoring for Legionella at the Department of Health that we do as a regular compliance basis, although there are several rules that we look at that directly look at disinfection practice and bacteriological control. So the revised total coliform rule looks at disinfection residual throughout the distribution system, as well as bacteriological testing in the form of fecal coliform and E. coli. This is one way that we get an idea for potential impact of low residuals and of chlorine and chloramines, and try to assess any bacteriological risk. As well as this disinfection byproduct rule looks at production of disinfection byproducts for disinfecting systems, and can also point to areas of a system that may have longer water age and are more prone to these issues of opportunistic pathogens. We also, through our sample collection guidance, try to identify sites that serve these sensitive populations that are more likely to be affected by by the risks of Legionella and opportunistic pathogens, and make sure those are part of the system's monitoring as they're doing any total call from testing. And we encourage monitoring throughout the entire distribution system to make sure we are understanding the risk that's spread throughout an entire public water system. We also look at disinfection guidance and regulations from other agencies and other groups. 10 state standards recommends a 0.2 milligram liter chlorine residual throughout the distribution system for all water systems, or a 1.0 milligram per liter chloramine residual. This is what we look for when we are conducting sanitary surveys to make sure disinfection practices are meeting these standards. In addition, design standards for chlorination and distribution systems are maintained by 10 state standards to make sure that they are able to be flushed and provide chlorine safely. We have a lot of guidance on our website that we'll make available to the attendees here, but our current Legionella and water quality guidance we have directed to different groups. First, for homeowners, some suggestions that they can do. They don't have as direct control over the water quality as a water system or a building manager for a larger building. But there are some steps that they can do. So flushing faucets after longer dead periods or pressure changes to make sure that they have fresh water present in their home that has not been stagnant for a long time is a critical measure. Cleaning devices that use water, especially medical devices, but any device, including water faucets, cleaning your aerator and cleaning filters and maintaining those can make sure that you reduce the risk of opportunistic pathogens. Conducting proper maintenance of water heaters and flushing those as needed on a regular basis. And then communication with your water utility. When you are seeing issues that you are noticing, making sure you're communicating that to your water utility, and they can make sure to check that proper chlorination is occurring and reaching your home. For those who have private wells, keeping those safe is definitely a priority, and making sure that there's less risk of pathogens. And discussing, if you are living in a larger building, what the potential options your building manager can undergo. For those who do operate larger buildings, such as apartment buildings or offices, there are some additional guidance for them. Flushing regularly to remove stagnant water, including appliances, and then coordinating that information with the residents of that facility. Can really help to make sure that a flushing program is done effectively and make sure that it is resulting in as little stagnant water as possible that can harbor these opportunistic pathogens. Regularly checking water quality parameters, including temperature, pH, and disinfectant residual to make sure that you've identified any low spots where opportunistic pathogens can be found, and then removing and disinfecting those shower heads and faucet screens on a regular basis. Additional steps, cleaning decorative water features and maintaining pools and spas. These are often harbor these Legionella and other opportunistic pathogens. So performing all required maintenance for those, and cooling towers for facilities that have to use those. Those are often a source. Finally, all this goes together into establishing a water management plan. This is a critical step that larger facilities should look at to make sure that water quality is maintained. And then the research that's done by the University of Minnesota directly impacts how future regulations and guidance from MDH will continue to unfold. One big step that's coming is the microbial and disinfection byproduct rule enhancements. These are expected next summer, although the full rollout will be in the coming years following that. And these are all going to address some of the topics that were brought up in today's discussion, including a minimum disinfection residual, chloramination practices, and better management of premise plumbing and finished water storage tanks. An additional element here is that technical, managerial, and financial capacity. And this looks at making sure that the condition of a water system is maintained. The pipes that are old and containing biofilms that harbor these opportunistic pathogens can be replaced, and making sure that those steps are being taken to properly manage the water system and distribution system. And finally, I just want to look at MDH's future goals. So continue public education, sharing these materials and updated information as more research comes out to help provide the latest information to consumers, and guidance for water systems to make sure that they are following these best practices. Finally, collaboration is a key goal of us. And again, celebrating today our work with the Minnesota Water Research Fund and the University of Minnesota. Continue to work with these partners to progress their research and improving public health outcomes, because these findings do directly help in Minnesota with how we can continue to advance this area. So thank you once again. I'll pass back to our moderator.
Thanks, everyone. Since we're running a little short on time for questions, what we're proposing to do is to continue on shortly after 1 p.m. so that we can answer all the questions that were in the Q&A. And you'll get a link to the recorded version of the webinar later in an email. So you'll be able to see everything, even if you have to leave at 1 p.m. We want to make sure that we get your questions answered because they're really, really great questions. So with that, let's just start at the top and run through the bottom. Question number 1.
So I believe I was tasked with answering question number 1. It was from our friend Dennis Martinson, and he asks, do we have any information on how many cases of this have been related to the drinking water supply not having chlorination? And I believe he's referring to the Grand Rapids situation. And I would say that our understanding from the sampling that's been done both by us and especially by the Minnesota Department of Health in their investigation points to the drinking water supplies being the main issue there. But it's interesting that, I think that the main problem is that it's a premise plumbing issue and not necessarily a water main issue. So from our testing, we found that the water in the mains was largely low or non-detect for Legionella pneumophila. However, when you got into some of the buildings, you were able to detect fairly high concentrations, both via culture and also using our PCR method. So the problem ultimately is that the absence of chlorine, plus very likely significant levels of AOC, and we have been measuring assimilable organic carbon levels ranging from 30 to closer to 100 micrograms of carbon per liter in that system. So there's AOC in the water, food, there's dissolved oxygen, and there's these opportunistic pathogens, including Legionella pneumophila. So the conditions are there to grow the organisms. And with the absence of disinfectant residual, these organisms were able to proliferate in some of these premise plumbing situations. And so by adding chlorine starting in June, we're able to suppress the organisms. That's the fire extinguisher to put out the fire. And so I would say, hopefully I'm answering your question, that it basically, I think that the absence of residual disinfectant is really responsible for these organisms being able to bloom in premise plumbing. And so by switching to chloramine, I think that the system should be largely able to control Legionella, especially in these premise plumbing settings.
All right. I think what we'll do is we'll cut off questions. There's one more that came in, number 8, and I'll have Ray or Tim answer that, and I'll hand it to Indran for question 2.
Sure. So next up, we had how many outbreaks have been identified in Minnesota. So this number varies per year. The initial presenting of results about a decade ago, we had about 50 cases of Legionella a year. That's up to above 100 with 134 this past year in 2023. So an outbreak is 2 cases that are linked. So we have dozens of those throughout a given year, but in total about 134 individual cases. Most of those are tied to hot tubs or spas, as opposed to a more wide drinking water issue. But healthcare facilities have had some larger outbreaks that we do see pop up, and those are directly related to maintaining disinfection and all the practices we've been talking about today.
All right. Question number 3, Ray or Tim?
So the question is, how do we deal with a customer who demands higher chlorine levels because water will just...
Actually, I gave you the easier one. You
Oh,
get the one
sorry.
right ahead of that or before.
What are the suggested practices to minimize the potential for contamination and deal with it detected? Maintain a residual disinfectant, keep your water heaters hot, and use your water, and deal with it. Assuming you've got residual disinfectant, go to flushing.
Perfect. All right. Number 4 would be Indran.
And also just on the previous question, if it is actually being detected and you're seeing symptoms, obviously reaching out to a healthcare provider, and that's how the Department of Health continues to track things and the CDC to respond at a wider level if there's an outbreak. other question, how do we deal with a water customer who demands a higher chlorine level because water ages too much in their own system? So that's definitely a great target for making sure that you are monitoring chlorine residual close to that consumer, especially if that's a vulnerable site, to make sure that you're trying as best you can to maintain a detectable residual above that level as far as you can. But if it's still receiving concerns and questions, that's a great chance to point to some of our guidance we have at MDH regarding setting up a water management plan for their home, performing the correct steps for flushing and management of your personal home water system, or at a larger office or apartment building. So trying to push them to look at those practices they can take as a homeowner, as they have the direct management of their premise plumbing, and making sure that that's continues to be non-stagnant water.
Great answer. So the rest of these questions we're going to hand off to Ray and Tim. So it's all yours, Ray. Tim.
I'd be happy to take the next one. So there's a question about, is there a method to directly measure assimilable organic carbon, or AOC? And yes, there's a standard method. It was developed by a researcher in the Netherlands, Dirk van der Kooi, originally, and there have been modifications over the years, but essentially, briefly, it's a culture-based test. So you take two different pure cultures of bacteria, add them to the water supply, and then look at how many of those organisms grow in the water. So you basically monitor cell growth. And then by the amount of each organism that grows in the water, you can then back out how much food they ate from a yield factor. So it's essentially just a culture-based test, and it is a standard test, and you can buy the organisms from the American Type Culture Collection and so on. So if you have any more questions, let me know, but you could also just Google it, and you can find methods for measuring AOC in water.
I'll take the next question, which is, in groundwater systems, do you think the reduced Legionella was due to reduced assimilable organic carbon or reduced dissolved oxygen? And the answer is really both. That's why we don't get large numbers of Legionella. We will detect Legionella in groundwater samples, but we don't get really high levels like what we report in some of this data. But once we bring the water out of the ground, the oxygen inevitably gets introduced, and then that's part of the factor that allows Legionella to grow. We're kind of assuming that we can't prevent oxygen from getting into the water once we pull it out of the ground. And then, Ray, do you want to take the last one?
Sure. I guess, which of your findings, if any, surprised you? I would say, at least from my perspective, when we pitched this project idea to MDH, and they supported us during the pandemic and looking at university buildings, I figured that, the buildings had sat for several weeks, and I was fully expecting that we would see significant concentrations of Legionella pneumophila throughout these buildings. And in fact, we really did not detect Legionella pneumophila, especially using culture-based assays, and even with our sensitive PCR assay. So that to me was surprising. I really did think that we would see significant blooms of Legionella pneumophila. We did detect Legionella species, or bacteria of the genus Legionella, as Tim alluded to, using this SSRA gene, but really did not see significant levels of Legionella pneumophila. So that was a good thing. I mean, it was a good finding. And so we were actually quite pleased to see that. And we think that it had something to do with just this periodic exposure over time of chloramines through the building, even though it sat stagnant for several weeks. Just the fact that these systems had been exposed for many years to chloraminated water, we think basically just minimized the colonization of the premise plumbing in these facilities by Legionella pneumophila in particular. And so that was a surprise for me. And Tim may have a different answer.
Some things surprised me, but they were pretty subtle. I was surprised by, I guess in Grand Rapids, it surprised me how well-intentioned everybody has been throughout that entire process. It's not really a result, but just, hey, we recognize we have a problem, and we're all in it together, and we're gonna solve it. And that's been really wonderful.
All right, Shannon, I think it's back to you.
Well, thanks so much, everybody. We want to get you back to your day. We're so glad you joined us for the webinar today. And I want to thank our 4 panelists for your wonderful insights and for taking all these questions. And thanks to all of you for joining us here today. We hope our presentation has inspired you to get more connected with us at the Minnesota Water Research Fund. You see some ideas on your screen about ways to do that. We hope you'll join our mailing list. Go ahead and send me an email. I'd be happy to add you. If you want to be invited to future events like this, that's a great way to do it. And you will also get our future water research updates. We, of course, welcome your expertise and ideas, and you can reach out to our founder, Bernie, with those. And of course, if today's presentation was interesting to you, we invite you to help us spread the word. When you get the recording, please feel free to share it with colleagues. And finally, advancing water research like this and protecting and promoting our public health, it takes financial resources. And so we'd encourage you as an individual or your company or organization to join us as a 2025 Minnesota Water Research Fund partner. We have various partnership levels. And if you make your gift commitment before the end of this calendar year, you can double your impact. We have a special matching opportunity, a dollar for dollar match on all gifts up to the first $2,500 or $25,000 we receive. And so we would welcome you to join us in our mission to make sure that the University of Minnesota is a national leader in innovative water research that improves our public health and protects and preserves our Minnesota water resources. The link to join us is on your screen today, or you can reach out to me for more information. Thank you so much to our panelists. Thank you to the Minnesota Department of Health for joining us here today, and we hope to see you all here next time. Have a great afternoon.